I guess one of the things you specialize in is natural hormone replacement therapy. Tell me about that.
What natural hormone replacement therapy is essentially replacing hormones that are identical to what someone would normally make themselves. And this is a hugely popular area nowadays. However, in my opinion, it's often not done well. And what I mean by that is that there are lots of bioidentical hormones that you can take, but a hormone only works as good as the nutritional environment you put it into, and it's only as safe as the nutritional environment you put it into. So just because you are taking a quote-unquote natural hormone does not mean you have picked the ideal solution to your hormone problem.
Okay.
And this topic, of course, applies to everyone from perimenopausal women who are having hot flashes to teenagers who are having heavy periods to 60-year-old women who are having bone loss and are concerned about heart disease. And so this is a family of discussions, if you want, depending upon the person, the age group.
So who's a candidate for hormone replacement therapy? I mean, that comes to you? Menopausal woman?
Well, hormone replacement therapy is often thought about as estrogen, and let's just clear that up off the top here. When we look at hormone replacement therapy, first we look at what kind of a hormone balance does that person have. We measure their hormones. For years, women were given hormone therapy without any hormone levels being done beforehand.
No testing.
No testing. It was a one-size-fits-all. And unfortunately, that attitude is still very much alive and well in the medical community today.
So what are the commonly replaced hormones?
The commonest hormones that are replaced are the estrogens, progesterone, testosterone, DHEA, thyroid hormone, cortisol, and some of the hormones that the adrenal gland uses to make other hormones.
Okay.
Which means that that's obviously not a short list, which means that when you look at someone's hormone levels, you need to look at all of those to know exactly what can they benefit best from.
So are you replacing hormones, or are you replenishing hormones, or does that mean the same thing?
Well, that's a good question. Ultimately, the goal of hormone therapy should be to create health so that a woman, let's take a woman who's in menopause or perimenopausal, for example. What's often not talked about is what is a normal menopause transition. And ordinarily what should happen when the ovaries go to sleep is that the adrenal glands step up to the plate and happily make all the hormones that the ovaries did in enough quantities to keep your brain, bones, heart, all of that healthy. The problem is that because most of us have led this stressful lifestyle, been maybe a little malnourished, the adrenal glands are overworked, undernourished, and when you suddenly ask them to make estrogen, progesterone, testosterone, they can't do it. So you may need to supplement those hormones for a while, but at the same time, in the background, you are restoring the health of the adrenal glands so that ultimately the woman doesn't have to stay on hormones for the rest of her life.